CDC illustrated in August of this year in a MMWR that was published that hospitals working in a coordinated way with the health department can identify outbreaks earlier, can interrupt transmission of antibiotic resistance between facilities, resulting in 70% fewer patients acquiring antibiotic-resistant infections than if the hospitals work in an uncoordinated way. So the essence of these state-based HAI antibiotic-resistant programs is for health departments to work with local leadership, get buy-in from hospitals and partner organizations such as quality improvement organizations and hospital associations to have expertise available either directly at the health department or through partnering with academic medical centers around the key functions or key subject matter around antibiotic resistance prevention. That includes analysis of data, that includes antibiotic stewardship, it includes prevention of transmission of antibiotic resistant organisms. The third key function of these programs is to have access to key data. Right now, most hospitals in the U.S. report some antibiotic resistance data to the National Healthcare Safety Network. Health departments can gain access to these data, can process these data, and can identify hotspots of antibiotic resistance in their community and act in a strategic way to use limited resources in the most efficient way possible. And finally, by having laboratory expertise, the health department can help guide laboratories that are not able to detect antibiotic resistance in a very efficient way to improve their detection capacity to respond to outbreaks better and prevent transmission. Right, so I think over the past, about a decade ago, the problem of antibiotic resistance was identified at the individual hospital or healthcare facility level, usually an acute care facility. If they perceive they had a problem, they may consult with the health department or they may act on the problem themselves. And there's guidelines that are available for hospitals to use to respond to new antibiotic resistance that has emerged in their facility. And they can do a very good job of preventing transmission within their facility. What's really come to light over the past 5 years is just how interconnected all the healthcare facilities are, the long-term care facilities, the long-term acute care facilities, and the short-stay acute care hospitals. And by addressing antibiotic resistance just individually and independent of one another, we don't take into account patient transfer and patient mobility across the spectrum of care, and we don't take advantage of shared experience and identification of best practices and building some momentum within a region and taking a shared responsibility for the success and failure of the antibiotic resistance problem in any one community. So over the past several years, there's been scientific progress and knowledge gained through the advance of some research around the interconnectedness of healthcare facilities that has really highlighted the key importance of interrupting that transmission between hospitals and other types of value in shared experience across the region. So guidelines for preventing transmission of antibiotic-resistant organisms within and between healthcare facilities actually have been available for quite some time. It's the implementation of those guidance that's taken on a new flavor by recognizing that a centralized authority like the health department, by identifying which acute care facilities are most influential in transmission of antibiotic resistance, can take a targeted action at the right time using these established guidelines. So it's just about the science of implementation that's really advanced. The August MMWR presented data. It was modeling data, so it's theoretical data that illustrated the benefit of a coordinated approach over an uncoordinated approach. And by coordinating action, as a new antibiotic-resistant pathogen is introduced in a community of healthcare facilities, results in 70% fewer transmissions of this antibiotic-resistant organism compared to hospitals acting independently based only on their own data.